Hi, my name is Madison Brown. On today's episode of CNS Education Series, we're going to be talking about attention deficit disorder. Attention deficit disorder and attention deficit hyperactivity disorder are behavioral disorders characterized by symptoms such as difficulty concentrating, impulsivity, and forgetfulness. People who are diagnosed with attention deficit hyperactivity disorder also display excessive activity and often an inability to control their behaviors. ADD and ADHD affect executive functioning skills. These are located in the frontal lobe of your brain. ADD in concussion patients and TBI patients often affect the frontal lobe, with ADD being one of the common behavioral consequences of TBI. This is seen in 20 to 50% of TBI patients. If you think that you may be suffering from symptoms of ADD, difficulty paying attention, difficulty concentrating, an inability to multitask, or to shift your attention between tasks, you should seek out an evaluation by a brain injury medicine specialist. If you are diagnosed with attention deficit disorder, there are multiple options for treating it. You may start with options such as coping skills and therapy. This may include school and work accommodations, or medications such as stimulants and non-stimulants. There are many coping skills for attention deficit disorder. First, start by breaking down large tasks into smaller, more manageable steps. Create lists. Prioritize these tasks on your list according to how important and how urgent they are. Use timers when completing time-consuming tasks. This will help you break them up appropriately and help you stay focused during shorter periods of time. Utilize a planner or a planning app. This may be on paper, on a calendar on your refrigerator, or in your smartphone. Set aside time for brain breaks. You should allow yourself a 10 to 15 minute break for every 45 to 60 minutes of work that you do. School and work accommodations may contain a combination of the above. Your healthcare provider can help write these accommodations for you in order to optimize your performance both at school and at work. Occupational and cognitive therapy are also tools to help you build these skills and help to repair the damage done by the TBI or concussion. Occupational and cognitive therapy can specifically work on attention deficit disorder, functioning skills, executive functioning deficits, memory, as well as many other things. If you've tried the things on the last slide and not had any benefit, or not had enough benefit, your doctor may consider adding a medication for attention deficit disorder symptoms. These medicines are often broken down into two different groups. The first group being stimulant medicines. Medicines such as Adderall, Vyvanse, Ritalin, and Daytrana increase the production of certain brain chemicals such as norepinephrine and dopamine that aid in focus and attention. There are multiple negative side effects of these medicines as well that should be considered when picking the best medicine for you. Some possible side effects may include dry mouth, decreased appetite, increased heart rate, and possibly even an increase in anxiety. One side effect of these medicines that is generally not tolerable by a brain injury medicine group is the fact that they can interfere with your sleep. If you are prescribed one of these stimulant medicines for attention deficit disorder, please make sure that you are taking them early enough in your day that they don't interfere with your ability to fall asleep or stay asleep. As discussed in the Basic Health Essentials video of the CNS Education Series, sleep is one of the most important things that you can do to recover from a concussion or a TBI, and we certainly don't want a medication to interfere with that. Another group of medications are considered the non-stimulants. These may work to either increase production of certain brain chemicals or to reduce blood pressure in the brain that may be affecting attention. Options include Intuniv and Strattera, as well as Wellbutrin, which is generally used as a depression medication, but has an FDA approval for attention deficit disorder. Thank you so much for tuning in to this episode of CNS Education Series. If you have more questions about attention deficit disorder, or if you are suffering from attention deficit disorder due to a concussion or a brain injury, please contact our office, Center for Neurorehab Services, and set up an evaluation. Thank you.